Good morning, everyone. I hope you're all staying safe and well in these very strange and somewhat challenging times. My name is Rob Jones. I'm the Group Development Director for the Thomas Carroll Group, and I'd like to give you a big warm welcome to our COVID-19 Return to Work Health and Safety webinar, the first in a series of webinars that we will be running over the course of the next few weeks. So please keep an eye out for our emails, and you should get some more information and detail on these as and when they arrive. Lee Chamberlain, a Senior Health and Safety Consultant with Thomas Carroll Management Services, will be leading today's presentation and discussing those pointers set out in our agenda. For those of you who might not have seen it, just a quick reminder, establishing a plan on returning to the workplace during COVID-19, identifying who is at risk, deciding on who can return and those who should perhaps remain working from home, examining the working environment, assessing the risks and establishing safe systems of work, identifying a plan for emergencies and how to monitor the new working arrangements. Now, Lee has a wealth of knowledge, is highly qualified within the health and safety industry, over 20 years working on health and safety projects and consultancy, and 10 of those, thankfully, have been with Thomas Carroll. Unfortunately, we will not be running a live Q&A at the end of this presentation, but Lee will be available to take your questions, which you can send in via email to hello@thomas-carroll.co.uk. That's hello@thomas, Thomas-Carroll, CARROLL.co.uk. Now, whether you're an employer or you're self-employed but work with others, you do have a duty of care to those who may be affected by your business activities. So I very much hope that you find this presentation interesting, informative, and perhaps most importantly, useful. So let's get on with it. Thanks again for joining us, and let me hand over to Lee.
Many thanks, Rob, for the kind introduction. And as Rob alluded to, my name is Lee Chamberlain. I'm the Senior Health and Safety Consultant at Thomas Carroll Management Services, part of Thomas Carroll Group. And part of my remit this morning is really to kind of give you an overview of the health and safety related guidance that you need to consider if you are looking at returning to the workplace in some shape or form during the current coronavirus pandemic. This presentation is part of a series of webinars that Thomas Carroll Group will be providing you, covering various subject topics in relation to the workplace. And there will be an opportunity at the end to post any questions via email to me at hello@thomas-carroll.co.uk, where I will be able to hopefully guide you and support you with any information needed. Okay, thank you very much. So in terms of the presentation, I'm just going to run through the kind of overview, objectives, the detail, and then obviously give you some scope and pragmatic kind of guidance around, some of the things you should be at least considering when you are looking to return or to enhance the number of people in the workplace. So, we need to start off with, background information as to why we are in this current situation with the pandemic and how that then applies to the legal kind of aspects and requirements and how you manage workplace health and safety. What we have seen to date, many of us have been on lockdown for probably the past 2 months or so, of varying things happening in the press with regard to information, both, whether it be government published, different organisation approaching things perhaps in different ways. So we're just kind of looking at that from a purely health and safety requirement aspect, and hopefully, we're going to give you this kind of framework or, sort of plan that you can then approach your own specific circumstance. Key to this, as with anything, when you start to organise perhaps new systems and ways of working. It has to be achievable, and the plan itself has to be one that will be workable with the people involved. So, key to that is the consultation side of it, getting people's views, whether it be indirect or direct employees, it could be members of the public and so on. You have to consider all elements in terms of the workplace and who populates it or who may come into contact with people. We'll also look at things like the workplace layout, the workplace precautions, and what type of things you need to put into place. Whether it be as simple as floor markings to, demark a 2-meter zone, or it could be something more informative, such as signage, posters, and specific instructions. So again, elements of that we'll talk about. And also in relation to that, how you then apply this in terms of a new way of working, perhaps a new thought process around what you did previously. And as we can all appreciate, the pandemic itself is something that's going to be around for a little while longer at least, and so therefore we have to then, put these measures in place, and we have to at some point check and monitor to make sure they are working correctly. Because the key to any good plan, any good system for working safely is to make sure you are proactive in those measures. So that's the kind of overview and the objectives to which we're going to be talking about this morning. And I'll just run through again some of that background information. As we know, it's been very well publicized in the press. The coronavirus pandemic is fundamentally a public health issue. Part of that thought process really is if you are in the workplace and there is the likelihood of coming into contact with someone who has the virus, then there is a absolute duty of care from an employer's perspective to ensure that you are protecting anyone who is affected by that. So, in years gone by, typically, a lot of focus has always been on the higher risk sectors that we traditionally think of when we think of health and safety, construction, waste management, manufacturing, etc. But what we're seeing now, in particular with the COVID-19 situation, a lot of the traditional lower risk sectors, things like offices, retail, not typically high risk in terms of day-to-day activities, albeit there are health and safety issues to manage. Traditionally, they weren't the highest kind of priority, if you like. But because of this pandemic, we're now seeing almost a different approach to these lower risk environments, and they're the ones in some ways that are more affected. So, trying to create new systems in an environment that perhaps are not used to managing or working that way, trying to create a new normality can be very difficult. So again, this is kind of some things to consider, depending on what sector you're in, and also looking at the people involved and how the plan can then be implemented. But obviously you have to understand from a basic perspective what the law requires. We've already mentioned coronavirus as a public health issue. But as from the workplace perspective, those of you not familiar, there are fundamental acts, regulations, guidance. Even with this new pandemic, we've had the introduction of the Coronavirus Act, which kind of gives Parliament power to implement emergency responses depending on how the pandemic spreads and the severity. And part of that is adjusting current legislation. But really, what we have to look at is how we identify in our specific circumstance, our workplaces, how we take the information that's provided both centrally and from our existing policies, procedures, risk assessments, and adjust the way we work. Yes, you have to do, going into detail, a risk assessment based on COVID-19 coronavirus. But what you have to do more fundamentally is examine what you were doing previously and then apply these new rules to those activities. And that has to be the way forward, because rather than introducing something completely new, you perhaps may need to make some slight adjustments to what you're doing already. And I think that way of working sometimes helps, and it sometimes, is an easier way of managing the risk, particularly something that's introduced to the workplace. Just on that theme of legislation, there are things there, quite specific things like the management regulations talk about risk assessment, training, PPE, and so on. Obviously, COSH is in relation to harmful substances. There have been some slight subtle changes to other things, you could argue. There's a regulation about welfare arrangements, about rest, wash, toilet facilities. Again, you would have to consider what the regulations require in terms of the provision of toilets, wash facilities, how are you going to manage the amount of people, the spread in those type of environments. Also, not on that list, but some of you may have heard of the term RIDDOR, Reporting of Injuries, Diseases, Dangerous Occurrence Regulations. There is a note on the HSE website in relation to coronavirus and RIDDOR. It does become reportable under that in certain circumstances where it is deemed to be contracted directly from workplace activities. So again, it's an unlikely event in the majority of workplaces, but equally it could still be applicable. So in summary of the kind of legal requirements, regulations and so on, it's about understanding what you had in place prior to coronavirus, how then you have to apply the new, if you like, rules and guidance to what you do as a business, and then fundamentally how you then implement a new plan, procedure, and a way forward that everyone involved will hopefully understand and will buy into that new process. Which again, the planning side of things, looking at from your own perspective, you may be one of those organizations that were pretty much running or have been running throughout the pandemic itself, because of the nature of your work, because of what you do, how you do it. It may have been the case. There are some companies out there that have operated on a partial status, and there are some organizations that have completely shut up shop, if you like, and then a new formal startup process is required. And again, particularly for those type of situations, you've got some guidance, to look at in terms of that. So, you may be one of those that may apply to your circumstance. And you've really got to kind of bring all those things together. With your risk assessments in particular, I can't emphasize enough about knowing your people, knowing who is going to be affected, what in addition to what you currently do is going to affect individuals. It's okay having a blanket approach based on generic guidance, but unfortunately, as with lots of things in relation to health, you have to look at individuals in isolation sometimes, because you may have a situation where a job role is required for the business to reopen, but then you have the individuals who are normally engaged to do that job. They may not, for one reason or another, perhaps they have personal issues that don't allow them to come back to work, or it could be that, just from a purely mental health or anxiety perspective, they don't feel it's appropriate to return to work. So you have this situation where you have to look at the people in relation to this new challenge that is being posed and try and come up with a solution that is sometimes very individualized. Part of the new thought process, and again, this duty of care that I've mentioned, is also bearing in mind that, as years gone by and the previous kind of approach, the Health and Safety at Work Act, and the associated regulations that we've just mentioned generally apply to people in the workplace once they have arrived there. With this public health pandemic, you have now got to consider what effect that individual employee's commute may have on them and others who are, perhaps sharing that space with them. So in some ways, it's a bit of a new concept that we now have to consider in our risk assessments, something that perhaps hasn't always been, or certainly for the majority of people, relevant. And again, looking at the various activities, the various working environments, there's no one size fits all with this. There's lots of good guidance, but you have to apply it to every single circumstance, whether it be an office-based environment, whether you work outdoors, warehousing, and so on. There's lots of different permutations that you have to consider. Part of that key consideration then, and I can't emphasize enough, you have to get people's buy-in, and you can only achieve that by the consultation process, getting people's thoughts before people return to work, having a plan, speaking to them, getting a consensus. What are their thoughts? What are their feelings? And how could they contribute to the bigger picture, even before you open the doors again? It's vital those key people are part of that planning and thought process. And again, the biggest part of any health and safety system, you can write a very detailed, comprehensive risk assessment covering lots of information, and it can be applied on day one. But unfortunately, as we all know in the real world, day 2 and 3, things change. So you have to ensure that whatever you put in place, whatever plan you establish, it's an evolving situation. It's something that will and fundamentally will change. Okay. And it's ensuring that, when you do put that plan in place, have that flexibility, have that kind of thought that, it's new to lots of people. So there are going to be teething troubles. There are going to be things that you initially think are workable or achievable. Subsequently, they may not be the case. So again, think about it from a, consistency basis. And also, bearing in mind that there may be those individualized factors. It may not be apparent from day one. For example, you may have a member of staff that does return, but the anxiety of that return, the way of working, the new surroundings, the new environment, the new regimes may be really difficult for them to deal with. Or equally, you could be, looking at the risk from the kind of the highest protection element, and you may decide the majority of people work from home. And again, albeit it be safe, it may not be the most appropriate for some people to work at home for the foreseeable future. So there has to be a balance with that. Again, can't emphasize enough, that new normal has to be something that we must consider. Okay, and again, just to kind of top and tail that really in terms of the people involved, you have to have a consensus from the senior people within the organization. You have to work out, first off, what kind of activity, business function you are going to be opening up again during this pandemic. And subsequently, are you able to achieve that with the people who are available to you through various circumstances? So again, that has to be part of your thought process. Okay, and again, emphasizing the home workers as well. Let's not forget them, because there could be challenges that you're not aware of fundamentally as well. What else you need to look at? The interaction, where the work takes place. Previously you may have had a situation where, for example, you had an office environment with maybe 10, 15 people there. Under the new guidance, under the new rules with social distancing, that may be down to a quarter of the previous people or even less. So that is going to have a huge effect both on, you could argue, productivity directly in the workplace, the ability to fulfill functions, but also the people involved. Are there enough people to do the work properly, safely, and efficiently? Key consideration around things like shared facilities, as far as how do you get in the building? Have you got contact with surfaces where multiple people could potentially catch the virus from each other? So you look at, rest facilities, toilets, kitchenettes, and so on, and then you work out fundamentally whether we can actually operate the way we did before without harming people and without the spread of the virus potentially impacting people. And so on. So the key consideration around the communication is really, if you're expecting someone to work differently or to choose a different way of working or to perhaps alter the time and the frequency of what they do, there has to be a clear communication. You can't really put a plan in place without that happening. And part of that really is getting buy-in, making it clear to people what is expected of them, getting their feedback, and hopefully getting the buy-in and the fundamental kind of acceptance. And if you like, ownership. Ownership is really important in terms of introducing new systems. As you probably, some of you may have seen, there is guidance that has been provided, particularly by central government. There's, I think, 7 or 8 different specific guides around different workplaces, ranging from outdoor work, construction sites, through to offices and so on. And it does give you a baseline to start your thought process from. That combined with your knowledge of your workplace, your knowledge of your people, your newfound understanding of the typical things coronavirus may present to you, you should use that as the basis to form your plan, your risk assessment, your safe systems of work. Okay. For those organizations that perhaps have completely shut up shop, for the duration, the 2 months plus that a lot of us have been on lockdown, there's certain things that perhaps, if you haven't already considered, you must look at in relation to utilities, and certainly the safety elements around that, the key things that have been listed there. One of them in particular, when you're talking about Legionella and bacteria buildup, certain water temperatures can allow the bacteria to build up, particularly the hot weather that we've had recently. You may have water storage that's in that kind of danger zone of between sort of 20 and 45 degrees, and water that hasn't been either monitored, treated, or tested. So that would be something you need to consider. Other thing there, which someone mentioned the other day, which I thought, to me was a valid point. When you consider fire safety, the first thing you consider in lots of places, right, is an emergency evacuation, which tends to involve a lot of people grouping up, evacuating a building in close proximity, which kind of goes against social distancing. So again, you have to consider your emergency situations. If you are, for example, planning a drill during the pandemic where there may be a few people in the workplace, you could argue that drill itself, depending on numbers, could be simulated because you don't want to, for the benefit of maintaining social distancing, create additional risk around coronavirus. But equally, if there were to be a real emergency and you did have to evacuate, that risk of that emergency from fire is greater potentially than the risk presented by coronavirus. So again, there's lots of different thoughts around the things you have to consider when returning to the work. There's been a few things published around, things like statutory inspections, lifting equipment and so on. And again, it's important to emphasize if something is outside the scope of the statutory inspection period, you have to risk assess the use of that and try and get that done as quickly as possible, with the view that, there is a legal requirement around that. So again, just some of the tips around introducing a new and enhanced kind of inspection and maintenance regime prior to entering the workplace again. Looking at the basics, we all know from the various press kind of campaigns and so on, hygiene is key. Minimum 60% alcohol gels, disinfectants, and additional cleaning regimes, frequency and duration. You have to ensure, something that was brought to my attention the other day, I was talking to a client about something, we were discussing the use of hand dryers in toilets, and that's a fundamental no-no at the moment because you are going to be spreading water droplets into the air in a small confined environment, in the toilet environment. So you have to be mindful of that. So paper towels rather than hand dryers as an example there. Rubbish bins, not just in the toilets, in general, in communal areas, offices, and wherever else it may be, making sure there's a lid, and then when these things are disposed of, it's done in a controlled environment. The well-publicized 2-meter rule, social distancing has to be a priority. But as we can appreciate, this is not always easy to achieve all of the time. That's your priority and that's your aim. And you should be looking to achieve that as best you can. But where you can't, you have to look at this. And if you look at this particular slide, it kind of indicates a hierarchy of control, really, where, the elimination of close contact is your priority. If you can't do that, like you see perhaps in Tesco or Asda, they have a Perspex screen at the checkout. It gives, the users of the checkout equipment the opportunity to have some form of protection. It's not as good, if you like, as the separation, but it's the next best thing. So again, look at different aspects of what you're doing and consider, the top, if you like, rather than the bottom in terms of what you want to achieve. Lots of talk around PPE, masks, P2 masks, P3 masks, surgical, etc. As a rule of thumb, and the HSE are a big advocate of this, you only need additional PPE if you're in a healthcare medical setting, or as I'll briefly discuss, if, for example, you are a first aider and you may have to then administer first aid to someone who is perhaps, carrying the virus. Other than that, PPE would be standard in relation to your previous activities outside of the COVID-19 pandemic. So again, just be aware of that. That's a real thing that's, a bone of contention, and it has created some confusion. Again, as I alluded to, enhance cleaning facilities, encouragement of hand washing, simple things like if you have a row of toilet cubicles and there's, not enough sufficient gap in between, you may have to, take some out of action. So you've got social distancing, restrict the amount of people in the area because it's a small area, increase ventilation when necessary to allow airflow, and ensuring that you are making that area as safe as possible with the additional kind of wash facilities and cleaning and so on. And again, including that kind of waste removal procedure where you can. Canteens, rest facilities, shared kitchens, use of microwaves, kettles and so on, in an ideal scenario, you should be discouraging this and encouraging people to bring their own, things in, food and drink, water, etc. If you can't guarantee the cleanliness, if there's no other choice, then your cleaning regimes have to be kind of rigid in terms of, pre-post use of any equipment. It has to be cleaned down and it has to have buy-in from everyone who's going to be using that equipment. So again, just ensuring you're considering the aspects of that. The cleaning schedules, aside from what you're doing before, you need enhanced cleaning, more regular, increased signage, increased knowledge, increased ownership. Things around, certainly when you are using cleaning products or cleaning materials, disposing of things in the right way and ensuring that you are not contaminating other waste and other people in the vicinity of the equipment and materials being used. The additional requirements during COVID-19 around first aid in particular would be a couple of pointers there. There is some guidance available that suggests if you can't attend your refresher training, the HSE have given a 3-month extension. Also, there is, kind of guidance out there that suggests you can share facilities and individuals within local areas. So if you've got a business next door to you that has additional first aiders and you're perhaps low on numbers, then an agreement can be made around that. And also, as we've said already, the enhanced PPE for first aiders, because you may well be treating people with the virus because you can't tell whether or not they have it. A couple of things around drive-in parking, try and ensure that you encourage people to not share vehicles, and obviously public transport usage is something you want to discourage if at all possible. If you can't discourage that and there's no other option, think about staggered start and stop times, so it allows individuals to kind of reduce the risk to themselves and others perhaps. And again, just consider, if you have vehicles provided for work purposes, that you are providing sanitization, wipes, etc. The workplace itself, there is some guidance published, as you've probably seen on this particular slide, where there is a poster or a notice that they're recommending, the government are recommending in their guidance that you display. And this just gives you 5 key indicators that suggest to anyone who needs assurance or just to demonstrate it from a proactive perspective that you have put the systems in place to try and manage in a proactive way the COVID-19 virus. So again, please ensure that this information is made available and is provided. No doubt you'd have seen various posters such as this, the 2 meters distance and so on. Signs themselves will not stop people doing things that they shouldn't, or it won't cover all aspects, but it will certainly help and enhance, and they are good reminders for people, ensuring that they are following the rules and understanding. And really just to kind of tail that off, really, your plan, your risk assessment must be proactive. It must be something that evolves. It can't be just a one-off event. And you have to make sure that those people who are involved are consulted, are taken seriously with their concerns, and certainly, are abiding by this new set of rules that we now find ourselves having to implement and introduce to the workplace, perhaps for the first time in many instances. Okay. Um, and really, that's kind of the message I want to give at this stage. As I said, this information is kind of backed up and kind of supported really with some of the guidance and publications that we've provided via our website, via social media. And again, as mentioned, please feel free to drop us an email. Myself and my team of consultants are more than happy to kind of provide any guidance or answer any questions that you may have. And also, just to consider anything or any concerns or any, point you in the right direction of any further information that you can get for yourselves. Thank you very much for your time this morning, and hopefully, the message that we provided this morning will assist you in, returning to work or managing your workplace in a better and a safer way. Okay, thank you very much. Take care. Bye-bye.